Question 351. Topic: Permanent contraception. Question: A couple presents for permanent contraception. The mother has multiple medical conditions, high BMI, hypertension, etc., while the husband is healthy. Which option is most appropriate? Options: A. Continue using combined oral contraceptive pills. B. Bilateral salpingectomy for the woman. C. Hysterectomy for the woman. D. Vasectomy for the man. E. Insertion of an intrauterine device, IUD. Correct answer: D. Vasectomy for the man. Explanation: Performing a vasectomy on the healthy partner minimizes the surgical risk compared to operating on a patient with significant comorbidities. This method is both effective and less invasive, making it the preferred permanent contraception option. Additional explanations for other options. A. Combined oral contraceptive pills. These are a reversible form of contraception and do not achieve permanent sterility. They also carry risks, especially in women with comorbidities, that are not justified when a permanent solution is desired. B. Bilateral salpingectomy for the woman. Although this procedure permanently prevents pregnancy, it involves surgery on a patient with high surgical risk due to her medical conditions. Itibase. Hysterectomy for the woman. A hysterectomy is an extensive operation with major risks and is not indicated solely for intrauterine device, IUD. An IUD is a long-acting reversible method rather than a permanent method. References: RAG 8 Contraception Guidelines. RAG Guidelines. Question 352. Topic: Dermatology, viral skin infections. Question: An image is shown that is characteristic of molluscum contagiosum. What is the diagnosis? Options: A verruca vulgaris. B. Molluscum contagiosum. C. Impetigo. D. Warts. E. Basal cell carcinoma. Correct answer: B. Molluscum contagiosum. Explanation: Molluscum contagiosum presents as small dome-shaped papules with a central umbilication. It is a benign viral infection commonly seen in children and is usually self-limited. Additional explanations for other options. A verruca vulgaris. These common warts are rough-surfaced and lack the central dimple typical of molluscum contagiosum. C. Impetigo. A bacterial infection usually presenting with honey-colored crusts rather than dome-shaped papules. D. Warts. While caused by a virus, warts tend to be more keratotic and do not exhibit the central umbilication seen in molluscum contagiosum. E. Basal cell carcinoma. A malignant lesion seen more in older adults that has a pearly appearance with telangiectasia, not the classic dome-shaped umbilicated lesion. References: Cancer Council Australia. Skin conditions. Cancer Council Australia. Question 353. Topic: Ophthalmology, ocular lesions. Question: An abnormality is noted on an ocular image. What is the most appropriate management? Options: A. Refer to an ophthalmic surgeon. B. Prescribe topical antibiotics. C. Initiate corticosteroid therapy. D. Perform an office laser therapy. E. Observe with routine follow-up. Correct answer: A. Refer to an ophthalmic surgeon. Explanation: Any suspicious ocular lesion should be referred to a specialist for further evaluation, which might include additional imaging, biopsy, or surgical intervention as needed. Additional explanations for other options. B. Topical antibiotics. These are useful for treating infections, not for evaluating undiagnosed or suspicious lesions. C. Corticosteroid therapy. While steroids can reduce inflammation, they might mask underlying pathology in a suspicious lesion. D. In-office laser therapy. Laser treatment is indicated for select conditions, but not as a first-line approach to an undiagnosed lesion. E. Routine follow-up observation. Delaying referral may allow a potentially serious lesion to progress. References: Royal Australian and New Zealand College of Ophthalmologists, RONSCO. Question 354. Topic: Endocrinology, thyroid nodules. Question: A patient with a thyroid lump has had thyroid function tests performed. What is the next appropriate investigation? Options: A ultrasound of the thyroid. B. CT scan of the neck. C. Plain X-ray of the thyroid. D. Fine needle aspiration cytology, FNAC, E. Reassurance and observation. Correct answer: A ultrasound of the thyroid. Explanation: Ultrasound is the investigation of choice to characterize a thyroid nodule. It evaluates nodule size, composition, and the presence of suspicious features that might warrant further evaluation by FNAC. Additional explanations for other options. B. CT scan provides less detailed information on thyroid tissue and exposes the patient to radiation. C. Plain X-ray, not effective for soft tissue evaluation, particularly of thyroid nodules. D. FNAC may be necessary after ultrasound findings suggest malignancy. However, ultrasound should be performed first. E. Reassurance and observation, inappropriate without further characterization of the nodule. References: Rag and Endocrinology Guidelines, RAGBED Guidelines. Question 355. Topic: Ophthalmology, herpetic keratitis. Question: An eye examination reveals dendritic ulcerations on the cornea, as seen with fluorescein staining. What is the most appropriate management? Options: Oral famciclovir. B. Oral prednisolone. C. Antihistamine therapy. D. Topical chloramphenicol. E. Topical steroid. Correct answer: A. Oral famciclovir. Explanation: Dendritic ulcerations are characteristic of herpes simplex keratitis. The treatment of choice is an antiviral agent such as oral famciclovir, which is effective in reducing viral replication. Additional explanations for other options. B. Oral prednisolone. Systemic steroids may worsen a viral infection if used without concurrent antiviral therapy. C. Antihistamine therapy. These do not address the viral etiology or the ulcerative nature of the lesion. D. Topical chloramphenicol, an antibiotic that is not effective against viral infections. E. Topical steroid, can exacerbate herpetic keratitis and is contraindicated in active viral infections. References: Therapeutic Guidelines, Ophthalmology, Therapeutic Guidelines. Question 356.